Hey, how are you? It's Tuesday morning, and that means it's time for Tuesday tips. I'm going to try really hard not to expose myself in this blouse because no one needs that. So two questions came through, one from Lisa and one from Colleen that I'm going to go ahead and address. And I'm not really sure, like, if you have more questions, let me know. And every Tuesday I'll do this. If people have questions, I'll address them. So let's get started. I'm going to read Lisa's question. And she says, low back pain. I want to do a 5K. Any advice? I have mostly done yoga for 2 years. Lisa, absolutely, yes, I have some suggestions for you. Okay, so the first thing I want to talk about is the low back pain. And then I'm going to talk a little bit about training for a 5K. As someone who I got knocked out of marathon training a few years ago because of low back pain. So first of all, I want you to know I understand. I'm with you, and it's really frustrating. So let's go right to the low back pain, which, by the way, is one of my very favorite things to talk about. Okay, so I think a lot of things happen and a lot of things contribute to low back pain. What people that come to see me, what I see a lot of are a combination of 3 things. And I want you to know that it's a process of unwinding these 3 things. There's not an instant cure. The first thing I see is often a lack of core stability. Often a lack of connection, or the muscles have gone quiet in the lower abdomen often. And so what happens is that the low back is like, I gotcha. I'm going to help you out, because the muscles in the front have lost their neuromuscular connection. So core stability is the first thing that I often will take a look at. The second thing I see often is, because we are a society that does so much sitting, is the hip flexors, which are the muscles that lift your knees up. The hip flexors, they get tight and contracted. And so what happens is that when you stand up and try to do any movement, the muscles pull the pelvis forward. And so what happens is the muscles on the back start to contract. And then you add running onto these contracted muscles and a pelvis that isn't stable, and you've got low back pain, no doubt. The third thing I would say is the tight, contracted low back muscles. So those are the 3 things that kind of contribute often to, and there's lots of things that can contribute, Lisa. Best if if I see you, I would have different suggestions, but these are 3 of the most common things that I see. And so as such, I would probably address all of them all the time, regularly in your body. So I would address lengthening the muscles in your low back. So let's talk about that really quick. So often, especially in Western culture, when we talk about lengthening muscles, we talk about like, oh, I'm going to stretch, I'm going to lengthen the muscles, right? Often that gives you a day or 2 of reward, but it doesn't ultimately give you length for forever. And that's what you want. You want length forever. And that, my friend, is where Soma yoga comes into play. That's where neuromuscular reeducation comes into play. So Lisa, I know that you've come to my class before, workshop before, but any Soma yoga class at Tula would start to address the tightness of your low back. So second thing I would talk about is your hip flexors. Same. When you talk about lengthening muscle, of course, the world is going to tell you to get in those deep lunges and lengthen your hip flexors. I don't say don't do that, because that feels often really great. But again, I'm going to come at it from a different angle, which would come from a somatic or a neuromuscular, more of a permanent solution to the problem. And I would invite you to not sit as much if you are. And then the third thing I want to talk about is with regard to your training for the 5K is I would never look at it as just run. I would also look at it as, okay, because I have low back pain, I'm gonna address that stuff while I'm doing the training. So I would weave it into your training for your 5K. If you haven't checked out Couch to 5K, I highly recommend. It takes you from 0 to a 5K in about 12 weeks. And it is a really excellent way to bring the ligaments, the tendons, your feet, all of the things up to snuff with your body, so that you can kind of train it all slowly and sweetly. And then I would add in stuff to handle core stability and low back softening. To help you, I've got a couple of core stability combination things that you can play with, Lisa, and I'll stick that link below once this video is done. Okay? If you have more questions, please let me know. Karen says, as I sit here watching your live stream, I think I need to stand up. I feel the very same. So much. So much. You know what else I feel? I feel like I need to drink some water because I'm like, oh yeah, I had a hot dog yesterday. Okay, you ready? Next one. By the way, if you're here, stick comments, stick questions in there. I'm happy to answer them while I'm on. Okay, Colleen is talking about upping her workouts. And as such, how do you, I'll read her question. Why am I trying to? She says, how to rest well, stretch well when you are taking your workout routine up a notch. Really great question, Colleen. Thank you for asking it. One of my favorite 2 words in training people is active recovery. I think that one of the biggest mistakes that we can make is after you have a hard workout is to just be like, oh my God, I'm just gonna sit on my couch. And the muscles get super tight and contracted. And so I like to use the words active recovery. Think gentle walks, think gentle yoga, moving around. These are all really excellent ways to allow your body to recover without being still. So I want to talk about what happens after a workout in case you don't know. After you amp a workout up, you're essentially asking your muscular tissues to take on heavy load, and what happens is essentially you're causing a little bit of destruction to tissue. Okay, so you kind of you're asking the fibers of your muscles to do more than they normally do it, and they kind of tear, micro tears, tiny little tears. So let's first start looking at this as a good thing. So let me tell you what happens. As the muscle fibers re-knit together after you've worked them out, first of all, a couple of great things happen. Number one, your metabolism for everybody is different, but about 36 hours, your metabolism rises as these tissues start to knit back together. That's the first thing. The second thing that happens is after they knit back together, they are stronger than they were before. Cool, right? The third thing that happens is as you start to get more and more lean muscle mass, your resting metabolic rate rises. You metabolize better all the time, and this is why I'm a big fan of strength work, right? Because you're adding lean muscle mass to your frame. Okay, so that is the 3 things that happen after you work out. So let's talk about rest and recovery. Active recovery, I would definitely embrace that and think to yourself, what can I do? So here is something that I love it when my name is used as a dirty word after a workout. Often my partner, who's sitting right here, he'll do a workout with me and then he'll be like, oh, Sarah, God, because he's having a hard time like sitting on the toilet or brushing his teeth sometimes, the arms. But here's what I want you to ask yourself when you're sore. Let's say your legs are really sore. Ask yourself, what can I do? And then work that area. So for example, if you have done a lot of squatting and your glutes are sore and your legs are sore, you don't want to necessarily rework those. You want to let them heal. But there are other things that you could be doing to support your whole body. So you can be like, oh, wait, I could do chest, I could do back, I could do abs, right? I could do shoulders. What can you do? So as you're resting, it's about active recovery. It's about moving gently, water, taking care of yourself, good nutrition, and also moving gently. But also, you don't have to wait for all the soreness to go away to work out again. You could ask yourself, what can I do? So that's helpful to me, so that I don't feel like I have to just sit on the couch to recover. Okay, I would say resting between, so let's talk about workouts. I mix things up so that I'm never working the same thing twice, so I have like a day between major muscle groups so that I am not working that same muscle each day. So if I'm working legs, I'll take a day or two off to let my legs recover and heal, and I'll just work on different things while they're healing. Does that make sense? I hope that makes sense. So I'm going to recap this. I would think active recovery, gentle walks, gentle yoga, water, eating really yummy food to help support your cells as they're regenerating and laying down this muscle mass. And then I would say the third thing would be ask, what can you do? So if you're super sore in one muscle group, what can you do in a different muscle group to complement the whole body? And if the whole body's sore, then goodness sakes, just rest. I think that's it. All right, so hey everybody, give me a hi, give me a hello. I'm delighted to answer any more questions for you. I am going to lay down a challenge for this week and see how you feel about it. I've been thinking a lot about caring for yourself and what that looks like. And sometimes I think it can be as simple as a nap. It can be as simple as drinking an extra glass of water. But I want you to seek out one nice thing, one conscious decision that you can do for yourself every day to care for yourself, to care for your soma, your body, your mind, your spirit. And get creative, because I think we've been sold a bill of goods about what self-care. That's why I try to stay away from that verbiage. But think of it more about, what could I do today to care for myself? All right, do one thing consciously. Not passively, not, oh, well, today I did this and this. No, I want you to make it a conscious decision of today, oh, look, today I'm going to XYZ. Okay, that's my challenge. I'll see you next Tuesday. If you have questions between then and now, please email me. My email is sarah@sarahtorino.com, or you can put it in the comments below. All right, have a great day. Good to see you. Bye. Next time I'll put chapstick on or something. Lotion. Okay, bye.